Hello, and thank you all for joining ChooseCare's first webinar. We've put together a short presentation to introduce you to our online marketplace, which is designed to simplify the way that care is booked and managed for everyone involved. We spent 12 months researching the social care market and developed ChooseCare in collaboration with the London Borough of Barnet, care providers, and people who use care services, and their families as well, and friends. You should now, or very shortly, see the agenda on the screen. Great. You'll notice that there's an opportunity to ask questions at the end. Some of you may have already sent them in advance, so we'll be going through those as well. Unfortunately, Nick Scully was unable to join us today, but I will be handing you over to Geoff Cunningham very shortly, and he'll be your host. Just a few words about Geoff. He's the co-founder of ChooseCare. And as development director, he heads up the team who are developing the technology to drive the website's functionality to make it easy to use and simple to manage for all our three key audiences, who are local authority staff, people who receive care services, and the care providers. Geoff has over 7 years' experience in developing technology to better connect people with health and social care services. During this time, he developed an understanding of the many challenges local authorities face in this area, and he used this knowledge and experience to work with his team to develop a solution, and called it ChooseCare.
Okay, thank you very much for that lovely introduction, Fenella. So there's going to be a few slides at the beginning where I'm going to be talking a little bit about the trends in the social care sector. Honestly, I think this will be not news to anybody. This is stuff that's been going around for years and years across lots of councils, so I won't be labouring it too hard. It's just to do a brief introduction for the live demo to get everything in context. So first of all, as we all know, the demographic shift in the UK is towards more and more elderly people, and in particular there's going to be a very big increase in the oldest old, the 85 plus category. Demographic shifts like this are extremely reliable. They're not subject to this kind of changes you can get with government policy. So these kind of forecasts we know are coming, and there's nothing really anybody can do to change that. But what that means for social care services is a bigger demand on their services. But within the older people bracket as well, there are also additional trends. So one of the main ones, of course, is the Care Act from 2014, which has a big drive towards personalisation and individual choice to give people more control of their care. I'm a big fan of this. I think it's a really good idea because in general, the more input people have into their own care plan, the better the outcomes we see for that individual. But there are challenges associated with that. Also with the Care Act, we also see more of a tight integration between local authorities, social care and health. This is a trend as well that's just going to continue over the coming years as these become more and more unified, and it's a big challenge for lots of councils. So within that then, to get personalisation, one of the key methods that we can do that is by giving people direct payments, personal budgets and direct payments. And this applies both for social care and for health. So as you can see in this graph here, over the last 7 or 8 years, we've seen the number of people receiving direct payments go up by a factor of nearly 4. And this is a trend as well that's going to continue. One thing we've seen with all the councils we've spoken to is that there's very much demand to increase direct payments amongst their service users. And again, I think that's a trend set to continue. ChooseCare can certainly help with that. But then within direct payments, there's also additional trends. So one of the key ones that we've seen is that big increase in demand for personal assistants, PAs. So this is a trend that's been going on for a long period of time, predicted to massively increase in the future as well. So this graph shows the next 10 years. As well as the past 5, and there's probably going to be a doubling or more of the PA workforce and PA jobs in the market. PAs in general are quite good because they on average, all the studies have shown they lead to better outcomes, and it means a tighter and better relationship between the care recipients and the person delivering care. Also, on average, they tend to be slightly cheaper as well than commercial domiciliary care providers, which again helps the budget pressures that lots of councils face. So the numbers estimate that there might be up to 1 million PAs employed by 2025 in the UK. So again, a big increase. So what does that mean for the market? So on one side of the market, we have consumers. So consumers are a vast and growing proportion of the population. There's literally millions of them out there, consumers for social care and health. But in general, they're very poorly informed. So a lot of people, especially to begin with, don't even really have a good understanding of what social care is and what options there are within that. And on top of that, it's actually a very emotional decision. We're talking about decisions that are often made during crisis points, and they can have long-lasting impacts as well on people's lives. On the flip side of that, we've got providers. So there's lots of different kinds of providers. ChooseCare is going to incorporate all of those in due course, but in particular, there's home care and voluntary services, equipment, care homes. The point is there's a very, very large number of them. So the provider market is highly fragmented. It's not like supermarkets where there's maybe 5 or 6 key players that you can choose between and are all household names. Here it's a highly fragmented market with tens of thousands of companies providing care. That makes it extremely difficult to navigate. So on one side, if you've got a vast growing consumer population who are poorly informed, and then combine that with to try and match amongst a highly fragmented, difficult to navigate provider market, there's a challenge there, especially if you're giving people money in the form of a direct payment and they have to make their own choices. So that's where ChooseCare comes in. It's going to be a marketplace in between those two players, and we're going to help match people to the appropriate provider and the appropriate services. And in particular, at the moment, we're focusing on a direct payment management solution for councils. So what are the challenges then based on that? So for local authorities, they can find direct payments difficult to manage. So for example, if there's chronic underspend of direct payments allowances, recovering that money is quite a slow and difficult process. It can also be quite challenging as well at the end of a direct payment provision if the money needs to be reclaimed. For service users, there's one of the conditions with a direct payment is a regular audit of the spending. So in some cases, that means people have to maintain receipts, invoices, collect information for that audit, and then send it out on a quarterly basis. This is a lot of work for the service user, and also a lot of work for the local authority as well to do that audit process. For providers, they also have some pain with direct payment clients that we've seen. The big one being that they have to sometimes chase unpaid invoices, and so they have a finance team normally in place to do that, but this is quite a slow and difficult process because we're talking about often very vulnerable people, and chasing down unpaid invoices is quite tricky. So all those 3 challenges we've tried to address with the ChooseCare platform to alleviate as much of that as possible. So the ChooseCare platform we hope to be as easy and as simple to use and easy to manage as possible. I think when we go into the live demo, you'll see that for yourselves. For providers, we're trying to reduce their costs and simplify their back office process, especially financial processes. For service users, we want it to be easy to navigate amongst all the providers. We want to be able to reduce their administration time and effort, and we also want to increase visibility as well for friends and family. And then for the council, we want to improve their internal operational processes around direct payments, particularly the setup and audit of direct payment clients. We want to improve community support and give them much more transparency about the kind and volume of spend that people are spending their direct payments on. We also want to try and reduce the idea of cash payments we also want to reduce the amount of cash payments as well, because they can be quite tricky to manage. So, at this point there, I think we go into a quick poll.
Yes, the screen should have appeared now that got a list of 3 options for you to select from. So if you would take 30 seconds to think about it and make a selection of which of the 3 you think is most important to you.
Okay, thank you very much. We've got the results back from that poll. I'll just quickly reshare the screen. So the results there were quite interesting, actually. We had quite a good split between the three options there. So about half of the respondents chose option A, understanding the self-funding market. About a third or so took option C, formalising personal assistance and how they're managed, which is actually a very complex, but also a very interesting question that we might cover later. And then the remainder chose option B, increasing the uptake of direct payments. This is broadly in line with what we've seen with the councils we've engaged so far, so that's always good to see. And the good news is actually ChooseCare, as you can probably guess, helps with all three of those questions. And again, that'll become apparent during the demo, but in particular for the self-funded market, seeing as that was the most popular poll response, the functionality we've built for direct payment management is actually is completely applicable as well to all self-funders. So part of the ChooseCare plan as we move forward is we get started with direct payment management, and then we also have a marketing activity alongside to help reduce demand on councils by increasing understanding and also uptake of services by self-funders. And we want to do that proactively rather than waiting for some kind of crisis where actually their needs might be a lot more severe. So I'll talk that through in a bit more detail during the demonstration to make that a bit more clear. Okay. So at this point then, we're going to transition across to a live demonstration of the platform. The platform's been live now for a couple of months. It is a new platform which we've just developed, but in co-development with Barnet and other councils, we've been operating with real people, real money, real care, real providers for about 2 months. I can't show you the live site itself for obvious privacy reasons, but what I will be doing is taking you through our QA environment, which we use for testing. That does mean all the data in there is demonstration data, and it won't be realistic, so you'll have to bear that in mind if you see a crazy number or something like that. Okay. So now we should have transitioned across to the ChooseCare browser. I'm already logged in at the moment as a care recipient, so I'm not going to demonstrate the idea of onboarding new people at the moment. I'm going to go straight into the functionality so you can get an idea of what the platform offers. So as a new user, I might straight away decide to search for care. So for example, I might choose to search for arthritis if that's relevant to my particular needs. That'll come up with a list of providers who are relevant based on what you search upon. You can see here we link across to the CQC. So in our research, we found out actually that almost all service users hadn't heard of the CQC. It's very poorly recognised among service users. But if you look at the website and the information they gather, there's actually a lot of detail there, and they also provide an important vetting service. So we've got a direct link into the CQC database, and you can click on any of these to get the latest reports for each of the companies. Let's say I'm interested in My Care Choices. I can click on View Full Details to get up to their profile. Each profile is populated by providers with it's their information, it's what they write, and they also suggest what kind of services they offer. We've got a bigger pull through here of the CQC information, and if I'm interested in this company, I might decide to arrange a free consultation. This form here is how they do that. You pick a date, you choose different services you're interested in, and I chose arthritis, for example, as earlier, so that might be an experience I would like my carer to have, along with any preferences and some extra information as well. So this was all co-designed, and this was all co-designed with providers to make sure that we had exactly the right information they need for those initial consultations. With the provider agreement, all providers on the ChooseCare platform have agreed to do an initial free consultation. This is normal market practice anyway. We've just formalised it slightly more with the ChooseCare process. So once a request like that is sent across, that is then viewable by the provider on their platform. They get alerted by that, and they go into the platform to respond to that. I won't go through now for time reasons the provider portal. If you're interested in that, we can show it in more detail, maybe in a follow-up webinar or in face-to-face meetings. But what I'll do now is fast forward in time a little bit in the journey and go to the dashboard that this particular service user has. So this dashboard here shows all the current relevant information. So for example, if I'd received a quote through from My Care Choices out of the back of that free consultation, that would be available here. This quote, for example, shows 5 visits a week from Steve as the carer in the morning on those days. It shows the cost per hour, the duration, and that would be a quote then which was discussed in the free consultation, which I can choose to accept or reject. All the quotes, once they're accepted, go through to the schedule. So this is really the core of ChooseCare. I don't like describing ChooseCare as an online marketplace, because actually really what we are is a care management hub for the user. So in the My Schedule here, you can see every appointment, every person. You can report any historical appointments if there was any problems with it, or if you'd like to give any feedback to the user. And you can also reschedule, cancel, and manage future appointments as well in the platform. So in this test account here, you can see I've actually got quite a lot of care. Most service users wouldn't have quite so much care, but I do a lot of demos, so this is why it's so populated with individual care appointments. But you can see this here, this kind of view here. What we've seen is the service users we have tend to print this out, stick it on the fridge, and this is their schedule, their weekly schedule for care, so that they're aware of what appointments are upcoming. If we go into a particular day, let's say on Saturday the 10th, maybe my my daughter might be coming around to help me. I might decide to change and cancel one of the morning appointments. So I can do that all in platform, and that goes directly to the provider for cancellation and approval. Alternatively, I can rearrange, delay, alter any of the appointments as well, and that goes through as a request to the provider. New requests, exactly the same. So you can see here we've got a complete way of managing appointments for all kinds of home care. This applies just as well for PAs. So we want PAs to log their time, manage their time in exactly the same manner, and that again massively improves the audit process for councils to make sure they've got more visibility of the ongoing care. But ChooseCare is actually much more than just a scheduling engine. So you saw earlier in the quote, you might have seen that had the pricing information and all that kind of stuff. Every appointment has an individual carer, a start day and time, and a cost per hour for the carers. So we are also kind of like a PayPal in the background, as well as just being a scheduling engine. So what you can see here, this view here shows a monthly overview of all the spending. So again, this is a demo account, but here you can see your own service user contribution. You can see the council contribution, and that gives you total income. And then you've also got the total spending as well, alongside that, based on all the bookings and activity you've chosen through the ChooseCare platform. And you can fast forward ahead or backwards in time to see forecasts in the future, or any historical data as well. It's important to note that all this information is also visible to the council. So from a monitoring and audit perspective, it's vastly simplified. You can see effectively, it's almost like a bank statement of all the different bookings, the costs, the companies, whether or not they've been paid. All that kind of stuff is available as almost like an audit page for the council worker associated with this account. In addition, we always know there's going to be some things which are not available to purchase on the ChooseCare platform. That could include things like taxis or other not platform-related spend. So there is also the option as well for service users to request some cash for that purpose, and the council can set a pre-approved cash limit for people as well. And if they ask for anything in excess of that, that then needs to be approved again by their council worker. We also have the ability to top up the account, so anybody can top up anybody else's ChooseCare account. So normally, of course, this would be a monthly process for the service user contribution, but in effect, as long as you pay into the ChooseCare account and quote a particular reference number, money is then immediately credited to your account. So friends and family can also contribute, anybody else can contribute into someone's ChooseCare account, and again, that's all completely visible to the council. I think that'll do for now on some of the key features of the ChooseCare platform. I look forward to any questions on that. We can always go into more detail on any other sections. So I'll switch back now to the presentation to talk a little bit more about how we design ChooseCare and also some of the commercials and other related aspects. Okay, so hopefully now we should be back on the presentation. So Fenella mentioned at the beginning the fact that we'd spent a long time doing research with service users, providers, and the council to try and develop this platform. So what we did is we actually pulled together a focus group of service users and a co-development panel within Barnet, our co-development partner, to try and design all these features, the way it works, the business logic, the reporting, the visibility of bits of information, all of that. And we got back all sorts of really interesting stuff from that process. I mean, it's things that we never would have thought of ourselves. So a good example would be providers are very interested in people and whether people have pets or not. So, for example, in certain communities, dogs are very unpopular for some carers for obvious reasons. So it's good to give that information early to providers so that they make sure they've got the appropriate carer who sends out. And service users, one of the things we found encouraging actually is just how much uptake there is of digital technology amongst the elderly. So we're currently conducting a series of surveys amongst our early adopter councils, and the latest results are actually 87% of our direct payment clients in Southampton are digitally enabled. So that was ahead of expectation. But even for the remaining 13%, we planned in a whole load of features for that, again, based on co-development, and that's the idea of a dedicated delegate who can act on people's behalf. So, and again, that's all done in an audited, controlled manner, and the council have visibility and veto rights over who can be a delegate and control people's spending. So co-development has been extremely useful. It's ongoing continuously as we continue to develop the platform over the coming years, and it really, I believe, it's the only real way that we can develop a sustainable platform that's actually useful to people. All too often, these kind of things are designed in isolation, and that doesn't work. So the commercial model, how is ChooseCare funded? How does it work? So first of all, it's free to councils and it's free to service users, and it always will be, but that's a core part of our business proposition. The core platform will always be free to councils. We don't charge any kind of monthly fee there or anything like that. To service users, it's completely free. They don't pay a penny either. The way we make our money is similar to a lot of other models like PayPal, like eBay. We have a small transaction fee on each piece of care delivered by home care providers and personal assistants. That's it's on the order of 6%. It does depend on the nature of the care, the nature of the spending, but it's like a credit card-like fee, and that just pays for the development of the platform and the scheduling functionality that we offer. Actually, moving forward, we see a lot of providers who we've spoken to about this. This is the preferred model, especially amongst the small to medium-sized providers, because what they were very reluctant to do is shell out a monthly license fee without any guaranteed sales volume alongside it. Here, providers know every single deal they do, they're only going to get charged for the work delivered, and they're never going to be out of pocket by spending a monthly fee, which they do, for example, at the moment with a lot of scheduling software and staff plan software. So Capita also, as part of the offer, will help councils identify cost savings. So there are a number of ways councils can save a lot of money with ChooseCare. There's the identification and more frequent clawback of unspent direct payments. But there's also a whole range of other internal processes that can be improved within councils to free up workload to do things like deal with backlogs or any other issues that the particular council might have. That's obviously very specific to individual councils. It changes area to area, but every time we've introduced ChooseCare so far, we've been able to identify significant savings as part of the integration. So we've been fortunate enough to have quite a bit of good press. So here's a quote from Tech Market View, who are quite well respected in this social care technology sector, and they were kind enough to say actually that we are the leader in the space for this kind of technology. There are a number of other companies out there, but none of them have the depth of offering that we have, and the fact that we offer both the initial marketplace, the purchasing, the scheduling, the automated payment for providers, so that every single month the payment comes in like clockwork. We offer a lot to all the different types of people who use the platform. So we are very pleased with that, we're very proud of that, and it's something we're only going to grow on and develop as well into the future with our roadmap.
So Geoff, thank you for that very succinct and informative kind of overview of ChooseCare. We're guessing that probably people out there have got some questions for us, and we've had some sent in already in advance. There should be a panel that would appear on the right of your screen, and in that there's a live chat box for you to type any questions. While you're thinking about that, I've got a couple that were sent in previously, which I will put to Geoff now. Geoff, would you please tell us about what functions and services you'll be adding to ChooseCare for 2017?
Yeah, absolutely. So as I mentioned, we are continually developing this platform. Capita are funding it, and they've got a large investment in this, so we're continuously going to develop it. For 2017, there's a number of areas that we're going to focus on. So I mentioned earlier the idea that personal assistants are very much a growing proportion of direct payments. That is our current focus. So for the next 3 to 6 months, we're going to be continually developing and building on our functionality for that. It is a very complicated area. Personal assistance, there's everything from employment law, tax and all those kind of things need to be incorporated into that. Setting people up as employers potentially, or there's other solutions as well. So we've got a number of options for direct payments and direct payment solutions for personal assistance. That's our immediate next focus. After that, we're going to branch out to other types of care, have more specialized functionality, things like voluntary and community services, clubs, and trying to basically integrate and connect the community more together, because that's a great way of using and utilizing potentially a lot of free resource. So that's going to become a more important push towards the middle of next year. And then finally, as an overarching theme over the next year or two, we're going to be talking more and more and developing more and more about integrating personal health budgets onto the platform. So I firmly believe that a platform like this doesn't have a future unless it can integrate adult social care and health. So over the next 12 months, we're going to be focusing on that, and we've already got a couple of co-development partners that we're going to be developing and designing a solution with. Personal health budgets in particular, they're over the next 10 years, they've got some extremely ambitious targets to hit, and we're just going to continue to develop that. Okay, it looks like we've got some questions. Let's have a look. There's quite a few questions actually. Thank you very much for that. It's quite tricky to see them.
But can we expand the box?
Yeah. While we're working to try and expand the box, I'll just go through the ones I can see currently. So the first question we got through was, is it possible to integrate this with our case management and finance systems? So clearly this does integrate to some degree with both of those kinds of systems, in particular finance. So when we designed ChooseCare, we designed this, while we co-developed it with Barnet, we were very, very keen to make sure that it's applicable to almost all councils, whatever their case management solution, whatever their financial solution. So currently we have limited integration with Mosaic, with Swift, with Paris, but it's not a direct link into the case management system. We were reluctant to do that because of the degree of personal data that is held there. Instead, it's more of like a one-off setup link when direct payment is chosen as the way that person would like to receive their care. With finance systems, what we effectively do here, because ChooseCare is a bank account in the background underneath all the websites and the user interface you saw, whatever finance system the council use, that needs to pipe money across into the ChooseCare client asset account, which is a ring-fenced account for client money. So there is a degree of integration there. The way we currently do that is by the sort of sharing of flat files. That's an extremely versatile way of doing it. And what it means for the payment teams with the councils that use ChooseCare is they just need to generate and submit a payment file each month into the ChooseCare via the council portal. So there is limited integration, but we don't want to spend too much money and effort and time integrating too closely with any particular solution. So we've made a general purpose integration solution for CMS packages and financial packages. Next question. Is there any financial advice or choice advice offered to service users? So there is, we are looking to incorporate information, advice and guidance into the ChooseCare platform, but only to a limited degree. So there are a number of incredibly good sources out there already for those things. So we see ChooseCare being more of an index and more of a way of accessing the appropriate, publicly available sources of information, rather than a dedicated and maintained information, advice and guidance section. So most councils already have some degree of information, advice and guidance on their government portals anyway, their gov.uk websites, but there's also a number of great national information sources as well, be that the Money Advice Services or NHS Choices or a load of other related ones. So within the ChooseCare platform, we're effectively going to have a section which would pipe people towards the best, the state of the art and the best IAG solution out there, rather than having all of that sucked into ChooseCare as well. So we're more of an index for that rather than a maintainer and creator of information, advice, and guidance.
So we're basically signposting people
right.
onto the best services that we know are specialists.
That's right. I mean, that may change depending on demand, but currently that's the plan. Is there any monitoring of services? Okay, so the way services are delivered on this platform, what happens is you get that quote through, like I saw. If you've met a company and you would like a quote, they will send one through. Once that's accepted, the booking becomes real on the platform. When the booking is real, you can see it, it's all part of the financial reporting and the rest of it, but only when that booking is marked as fulfilled do we then process that and pay that that booking. So that's a responsibility for the providers, and it needs a positive action for each booking to say that yes, this was fulfilled. So in terms of monitoring, that's visible with complete transparency to any linked council worker. So there's a council portal where you can see all the direct payment clients that your login is linked to. So if you're a social worker, for example, there might be 5 out of your 20 cases or something like that. Or if you're a direct payment monitoring person, you might be able to see perhaps 100 accounts there. You can then view and see all the individual transactions, what they cost, who went, what company provided it, and so there's monitoring from that perspective. In the future, we're going to develop an app, and the app will involve sign-in, sign-out functionality as well, using a NFC tag on the inside of the front door. So that will give us real-time information about the carer, where they are, when they arrive, when they leave. And again, this is all going to be offered free of charge, unlike a lot of competing solutions as part of the platform. Is there any regulation of prices? Right, so in terms of pricing, our core principle is transparency. We are not in the business of determining or dictating prices to the providers, but we are in the business of making whatever price they choose to quote for extremely transparent, not just to that service user, but to the council, and also potentially as well to other people searching for that provider. So when you go on a provider portal, when you go on a provider profile page, you'll be able to see there a whole load of information. For example, average price per hour of delivered care, and we know that because we hold that information. So you'll be able to see if a company is above or below average in terms of pricing. And then it's up to the user to decide whether or not that's relevant for them. That's the whole point of personalization and direct payments. So we don't directly regulate prices, but by making it extremely transparent, the information we've seen in the research we've conducted shows that increased transparency actually leads to a price drop of between 7 and 11%. And that data comes from similar systems that have been introduced as a prototype in Harrow with their community e-purse solution, which is a different kind of solution but offers similar transparency. Next question. There are items like the Sound Doctor which offer long-term condition management advice and assisted journeys. I take it this could be listed to purchase, but could it be viewed on the platform? So I think I'm not actually personally familiar with Sound Doctor, but I'm assuming this is about the idea that there's a number of technologies available which are smart and which can integrate with a platform like this. If that's the case, then yes, absolutely. What we're planning to do is have a smart care hub, which is and this is more sort of aspirational for once we've done our immediate development concerns, which I mentioned earlier. But with a smart care hub, you can feed in information from all kinds of sensors around the house, be it a sensor that shows whenever the kettle is boiled in the morning, pillow sensors, room sensors, motion sensors, and then a range of other different kinds of technologies. All that is going to be integrated into a smart care hub, and actually we're partnering with a company called Alcove in the early stages to do that, because we believe, again, there's massive savings and massive benefits to consumers and also friends and family with that kind of solution. If people on their app, on the ChooseCare app, got a quick alert showing something that had happened, or maybe something hadn't happened for a couple of days, then again, you're being a bit more proactive about responding to people rather than waiting for a crisis. Next question. This is a great way to enable an Uber Care model with local delivery. Can it deal with geographic convenience, i.e. add to a carer's journey for costs marginally less because it's local? The answer is yes, absolutely. So that's very much the direction which we're looking towards, in particular with personal assistants. There's a lot of personal assistants out there who want to try and increase their workload effectively, take on more work, help more people. And if we can show that actually somebody just down the road has a very similar need to someone you're already caring for, we're absolutely going to try and match that together to try and encourage people to take that up. And you're right, there's a massive amount of benefit there. You can cut back on travel, you can cut back on time, you can tap into potentially a lot more resource within the population which isn't currently realised, because at the moment that kind of visibility just doesn't exist. So that's very much the direction which we're heading, and good foresight there. You have the link to CQC ratings. Is there any functionality to make users aware of local authority intelligence around provider quality? Okay. So yeah, the link to CQC ratings is a direct pipe into their database, so it's completely live. In terms of functionality to make users aware of local authority intelligence around provider quality, we haven't seen any demand for that with our council so far. It does sound interesting. I would like to know a little bit more about the kind of intelligence local authorities have, but in general, going back to our core principle, the more information we can transparently share with the user, the better. And if we can get sources from local authorities as well, which have current, up-to-date, useful information, there's absolutely no reason at all why we wouldn't want to include that on the platform. We want to make that provider profile page as useful as possible to people. So part of that is the CQC. Part of that will be reviews and review functionality. That's the TripAdvisor type experience. Part of it will also be business intelligence that we generate based on our knowledge of, do they work more in the mornings? What kind of rates do they have at certain times of day? What kind of geographical coverage do they have? All that kind of information we can share as part of our business information for the provider. And if there's any other sources we can put in as well, like local authority intelligence, all the better. And that could take many forms. It could be a banner or a badge system for providers if they meet certain criteria. But again, the more we can inform the user about the different providers on offer, the better. Okay, I think that's it on questions. If there are any more, now's a very good time to have them in.
Just one thing I wanted to add, Geoff. We talked a bit about signposting, people asking for advice and guidance, etc. And of course, we do have our ChooseCare service centre, who we plaster all our communications on the website with the telephone number and the email address, so that people who are using services or providers, or I'm not entirely sure whether local authorities would need to, because they have a direct link to us, but they can phone or email, and there's a team of people working behind the scenes to help them there as well.
Yeah, very good point. The service centre in Coventry is completely dedicated to ChooseCare. They're quite highly trained as well as service centre people, and they've been handling our calls now with our service users for 2 months. And they're very different. They're very different and behave differently to a standard call centre. We call it a service centre because really they're far more interactive based on the type of people that we're serving. Yeah, so there's another question that's quickly popped in. Addition of user reviews, a la TripAdvisor or Airbnb. And again, absolutely, that's something we really want to do. So we're definitely going to incorporate that into the future. Review functionality is crucial to enable. I mean, a big thing about this industry is trust. You really need to trust the provider, and that's one of the earlier when I was talking about that gap between, that gulf between the consumers and the providers, and how we're trying to bridge that. A big part of that is enabling consumers to trust a certain provider, and the more we can do for that, the better. Reviews are a very big part of that. But also, if we can demonstrate that they're regularly on time, they get good feedback. If we show that transparently, we can help enable that trust and make the decision making a bit less stressful for the service users.
Might be worth mentioning that we do have feedback opportunities for people to give us some feedback on their provider, etc., via the website.
Yeah. So there's just a couple more that have come through. Can this be used as a platform for care comparison, a chat line on delivery? I'm not 100% sure I understand that question. Perhaps if it could be rephrased, I'll attempt to answer it. Does this only cover domiciliary care, or are care home placements also available through the system? It's a very good question. So right now, as part of our pilot launches in our first couple of councils, we are focusing on domiciliary care and personal assistance. But we also offer, and are currently being used for, day services and day care as well. Effectively, any kind of care that can be scheduled. However, very, very close in the future, and it's always been part of our delivery timeline. Very, very close in the future, we're going to be incorporating care homes and offering, visibility, map views, all that kind of stuff for care homes in the area, and to help introduce people to residential care homes. both in terms of long-term placements, which would be more of a handover, a referral, that wouldn't be managed by ChooseCare, but you just have visibility of it. Or what's more relevant to the core function of ChooseCare is respite care. So care homes are often used for respite, especially in LD. So if we offer respite care via the platform, that can be scheduled in, managed, paid for in exactly the same manner, and that's something we're very interested in. And yeah, it's going down the Airbnb route, as was mentioned earlier.
We're just quickly skimming through to see if there's any other questions that have come in while we've been talking.
Okay. Okay. So there's been a clarification to the earlier question. So I think the idea is I think it's about feedback around carers potentially. So earlier you saw in the scheduling we actually have the carer name associated with quotes. We have the carer name associated with bookings. That's really important again because it gives us data on exactly individual carer level. Who is getting good feedback, bad feedback. It helps give the consumer more information and build that trust. But the question is, if there's a lot of negative feedback for a carer, I think the question is, what if someone's in a bad mood and gives a carer a bad feedback, and therefore it might not be fair, for example. That's something that's very difficult to spot on a platform like this. So I think everyone here will be familiar with Amazon and places like that. They have obviously a lot of reviews, and some of them are one-star reviews, probably unfairly. People can buy something and they're in a bad mood or they're just an angry person, and they can give a great product or a great item a one-star review even though it's amazing. So I think the only real way to fairly cope with that is just to be transparent again. So ChooseCare could try and proactively intervene and say we will allow that review and we'll disallow that review based on its content. But really, by then we're taking away from the core principle of transparency that we're trying to achieve. That said, all reviews that will be visible on the platform will be moderated, right? So if there's something that's clearly inappropriate, bad language, or just a totally inappropriate review, or something that's not even related to the service that was offered, then of course that review would not be published. So there is a degree of moderation, but in general, our preferred principle is transparency rather than managing reviews. Again, as soon as you start doing that, the idea of trust becomes a bit more diluted. It's harder to trust a company if they're doing proactive management and showing exactly which reviews are allowed or not allowed based on their content.
And I assume also if one person's scoring Steve the carer as poor, but everybody else thinks he's fabulous, and can sort of balance itself out, hopefully.
Yeah. Yeah. Okay. Okay. I think that's it. I think we will wrap up there. So I am going to go back quickly to the presentation and. So finally, if we're very interested in having meetings and talking to any of the relevant people on the webinar, we're very keen to do demos, show people the platform, talk to people about the direction that we're taking ChooseCare. The entire system is very much built to scale, and we're looking for more and more local authorities who might be interested in future development or to take it on as a direct payment management system. If anyone has been interested in any of the content of the webinar today, feel free to email me, Geoff Cunningham, at choosecare.co.uk, or also Giles Reed, who's our sales director. He spends all his time on the road meeting councils and talking about ChooseCare, and he would love to get an email from anybody on the webinar. And thank you very much for attending. We really appreciate your time.
Thank you and goodbye.